not even the end of the day and your legs are burning, aching, and throbbing. You can't wait to put them up. A lot of people think this is a problem they just have to live with. But that's not necessarily the case. We're here today at Vein Specialist of the Carolinas with Dr. David Draughn, a general surgeon who turned his personal passion into his everyday practice. He's here to tell us how he can help you. Dr. Draughn, you got into this specialty because your wife came to you with leg pain and traditional measures couldn't find the cause. When should someone come see a specialist for their issues?
There are several reasons. The main reason that people think of veins is the obvious visible ropey veins and spider veins. But the majority of the time it's other things such as aching, heaviness, stinging, burning, itching, restlessness, cramping. Very vague symptoms, but they're very common, and oftentimes they're from your veins.
And what measures do you use to diagnose these?
The common test of a leg ultrasound is very commonly performed everywhere, but it's not done thoroughly enough to detect the source of the problem. The typical ultrasound is done with the patient flat and only look for blood clots in the deep veins. The ultrasounds that we do are done standing, and we study the deep and the superficial veins not only for clots, but also for reflux or backwards flow in the veins.
And then once a patient is diagnosed, you can treat them here in this office.
That's right. The old-timey vein stripping in the operating room under general anesthesia is out. Everything we do now is a simple, safe procedure. It can be done in the office, maybe a little sedation, maybe not, some little local anesthesia, and that's it.
And oftentimes covered by insurance.
Nearly all the time. If you have symptoms, you have reflux, it's nearly always covered by insurance and with nothing more than a copay.
Well, and what I learned today too is that it's not just unsightly veins that are the problem. I mean, they're accompanied by leg pain, by things that can really affect your quality of life.
That's exactly right. And I didn't believe all of that until my wife had it and she got treated, and it made such a big difference that I decided I needed to change specialties.
Dr. Draughn, thanks for your time today.
Thank you.
And this is an issue that will affect so many of us. Up to half of all men and 3/4 of all women will experience vein problems at some point in their lifetime. If it happens to you, why not come see Dr. Draughn, who's clearly so passionate about his profession. For more information, you can log on to his website, veinscarolina.com, or just give them a call.